Welcome. I'm Julie Thompson, Executive Director of PAC-TV, and today we're hosting a COVID-19 regional forum on mental health amid the pandemic. This virtual panel forum was organized by Representative LaNatra, who will introduce you to the experts she has secured for today's special. To watch this forum live in Kingston, Plymouth, Pembroke, and Duxbury, visit Comcast Channel 13 or Verizon 43, or watch online on our streaming channel by visiting pactv.org/live. To ask questions during this forum, please email them to kingstoninfo@pactv.org. And to replay this forum, simply visit pactv.org/regional. And now to introduce all her guests, LaNatra.
Thank you, Julie, and thank you for allowing us to host this today. It's very important to me. We're so focused lately on everybody's physical health, and we're not really talking about the mental health of our older people, the mental health of our children that are not in school, of the parents that are now working from home and taking care of their children, for our students that have some mental health issues and now they're home and they are not in their routine. So I am pleased to introduce my three panelists today. We have Sarah Cloud, we have Jennie Babcock, and we have Sandra Blatchford. We're going to speak a little bit with each. They're each going to talk about 5 minutes about their subject, and then we would be happy to take questions and answers. And myself have plenty of questions for you too. So first, I have the pleasure of introducing Sarah Cloud. Sarah is the Director of Social Work at BID-Plymouth. She sits on the opioid task force with the Plymouth County Sheriff's Department, where she acts as co-chair of the medical subcommittee of the task force. She's also vice president of Plymouth County Outreach Hope. And as on a personal note, she's a wonderful ballroom dancer. Thank you for joining us, Sarah.
Thank you for having me. This is just a really important topic, I think, at any given time, but particularly it raises a lot of new challenges in the midst of the pandemic. I think there's been a much greater need for resources. It's been very, very difficult for people who are given the message to socially distance. And socially distancing is absolutely saving lives and something we need to continue to do amidst of where we're at right now. But I really think it gives the wrong message. We really need to be physically distancing and socially connecting. I think at a baseline, prior to all of this happening, a lot of people were living with substance use disorders or, struggling with the amount that they were maybe drinking or different challenges in their life. And I think this has really just kind of turned things up quite a bit and added a lot of additional stress. And I want to come out to say that it's important for us to continue to stay very socially connected, even if we're physically distancing, and to reach out and continue to build relationships and reach out for help when you need it. Stay connected with our family via phone, via Zoom, via, all of these different avenues that we have. It's really changed the whole way in which we are delivering services and connecting. AA and NA meetings are now online. We never really thought that would happen because they were so connected in that physical, meeting. And I'm hearing really wonderful things about people who have made the transition from in-person meetings to Zoom. They're telling me that they're connecting with people all over the world who are in recovery and how powerful and connecting that has been. We've also hearing that detoxes are continuing to go ahead and admit people. Treatment is available and readily available in ways that it wasn't even before the pandemic. Telehealth has greatly improved immediate access. People can gain treatment and connection from not even leaving their home. Certainly, folks can continue to feel safe to come into the emergency room if they need to seek help for other substance abuse or mental health issues. We have capacity, we have the ability. We want to make sure that people know that it's safe to come in, both physically and they'd be welcomed. But it's also really important to know that they can access treatment from their own living room as well and don't need to leave their house if that's what they choose to do and that's what's right for them. So thank you.
Thank you. I just telehealth that was approved from the legislature, I think is a great way for people that actually don't want to leave their house because they may have health issues as well to connect. Do you
Yeah.
find that that's picking up?
It's really has quickly. I mean, I think there was an adjustment period of a couple of weeks as we transitioned from the in person model to the and got all the software up and running. But now I think it's really greatly improved access. I mean, the crisis teams are now able to do a telehealth assessment right there in the home. So that's been a huge improvement in terms of gaining access. Behavioral health, we're able to do outpatient and medication assessments and everything via the video conferencing. We have immediate access now to meetings. So people who may have been reluctant to go to their first meeting in person, it's can be intimidating, are now finding it much easier to go in via a Zoom platform or telehealth platform. We've transitioned over, so all of these levels of care that's kind of like alphabet soup for I think the general the general community, like partial hospitalization and intensive outpatient IOP, and all of these different levels of care are now available via telehealth where it's been in person before. So I think we have greater access, and we've now been able to eliminate, transportation challenges and other things, and just be able to do direct access to treatment from the living room.
I think that's wonderful. Wonderful. People that may have been intimidated going into a meeting can now do it by phone where it's a little more anonymous for them. My other question, Sarah, is we spoke so much about the opioid epidemic. And now that we have the pandemic, we're not really talking about it anymore. And I'm afraid that's going to get shuffled under the rug. And we need to really worry about what the effects are going to be after this pandemic.
Yeah.
Knowing how people are isolated at home, and when you're on social media or something, there's lots of jokes. If we talk about alcoholism, there's lots of jokes. Oh, I'm going to have a glass of wine tonight. Oh, I'm going to have a bottle of tequila tonight. That type of thing. So is that a concern, do you think, with many people will come out of this that did not have addiction issues prior to this, that that may be an issue?
I'm glad that you asked. I mean, absolutely, the opiate epidemic is something that we need to continue to work on and stay very focused on. It's very serious and is worthy the time. But I think that it outshadows the public health crisis we have with alcohol and that we had with alcohol prior to the pandemic. We know that alcohol use disorder is a progressive disease. It can start off slowly for a lot of folks, and then over time it progresses and advances. And I think the of all the people that come to the emergency room or to the hospital for substance use related, either direct or indirect issues, 80% of it prior to the pandemic were for alcohol. 20% for opiates. So it has been a very real concern and public health crisis for some time now. And I think the pandemic is fast tracking or, accelerating that progressive disease for folks. And I do think on the other end of this, we will have even more of a need for alcohol treatment and options. And, I want to reassure people that there is treatment available there. It's very accessible. It's a disease that is very treatable. If somebody had cancer, we'd say we know what it is that you need in terms of treatment, that it's been effective and it works. And people would rarely say, no, I don't want that treatment. But I think when it comes to alcohol use disorder, people very often say, no, I don't want the treatment, or I'm just going to continue as is, or I can manage it myself. But we know that treatment works, and we really have to engage in the same way that we would for any other type of disease and get the medical help that's needed. In terms of being part of PCO Hope, we do a lot of treatment scholarships, and the need for scholarships to get from detox into sober housing. The requests have skyrocketed. There's a huge need, and people aren't able to afford, but it's a very much needed treatment after detox to go into sober living. So that's a resource that's out there as well. We really want to help make sure that people have the access to the services that they need. A lot of people have lost their structure, their routine, have now have financial challenges because they've been laid off for work, and that is all kind of feeding into the disease of alcohol and progressing that along quickly.
Great. Thank you, Sarah, so much. Lots of things to think about. And I'm so pleased that we have the avenue now to do virtual meetings, and there is help out there virtually. I do have a lot listed on my Facebook page actually, and on my website too. So we're going to move on. Thank you, Sarah, to Sandra Blatchford. Now, Sandra is the program director for the South Shore Resource and Advocacy Center. That is right here in North Plymouth, whose mission is to seek the end of abuse and violence against women, children, and families, and to work to further a community culture that provides safety and support to those affected by domestic violence and to advocate for social change. Sandra has worked for the Resource and Advocacy Center for 6 years, and she has been in the field of domestic violence for 32 years. Welcome, Sandra. Thank you for joining us. Could you start a little bit of just telling us some of the programs that you offer at the South Shore Resource and Advocacy Center? Oh, we
We
lost her.
provide
Oh,
Unmute. She needs to unmute herself.
so if you need to unmute
Hi.
yourself, Sarah. There you go.
Can you hear me now?
Yes, thank you.
So what we do is we provide community-based and center-based services for domestic violence survivors as well as for children and teens. Our community-based services cover 18 towns, and we will meet people in the communities that they reside in, as well as offering child services and teen dating violence. We work closely with our police departments, and services include individual counseling, support groups, food pantry, a clothing closet, child care. We have a hospital-based program where we meet people at BID-Plymouth as well as Toby Hospital. And we also have our center-based services where we have individual counseling and group as well. That's where our food pantry is located. We have a small child witness to violence program located at the agency as well. And we have a 24-hour hotline as well as emergency backup services. And we do provide emergency safe homing to individuals who are fleeing from abuse. We also have a homicide bereavement program, a grandparents raising grandchildren's program, and what we call the Road to Healing program, which is a drunk driving trust fund program where we provide victim services to individuals who have been impacted by impaired driving. We also have a prevention education and training program for that program where we teach youth around the dangers of impaired driving. Additionally, we do a lot of prevention education in the middle schools and high schools in the 18 towns in Plymouth County that we cover to really teach kids about healthy relationships and what are the red flags. So that is primarily our services in a nutshell. We really rely on volunteerism, and we have an extensive internship program as well.
Wonderful. Do you tend to see an increase in domestic violence cases during this pandemic?
So what we've seen is a shift in the types of cases we're seeing. What has happened is that with the stay-at-home advisory, a lot of victims as well are living with their abuser. And so it is 24/7 that they are living with their abuser, and many have become recently unemployed, both the abuser and the survivor, and their children are also at home. So children are witnessing more abuse, and victims are experiencing a much higher level of abuse. And what we look at is that they are now living, that their homes have always been dangerous, but now they are increasingly dangerous because abusers rely on isolation and control, and they now have absolute control, and the survivor is isolated. Where they may have had support before from family and friends, where they may have been able to seek refuge at a family member's house or at a friend's house, they are no longer able to do that because of quarantining. So what we're seeing is the need for generalized services. Those phone calls have decreased, but we've seen an increase in need of housing stabilization, emergency assistance, and food, as well as more providing safety planning for individuals who are considering fleeing. We have a pretty extensive housing stabilization program. So, what we're doing is we have assisted people with groceries, with food, with clothing, with fleeing to another state or to another place within the state of Massachusetts.
This is so important to get this information out there because, as you said, an abuser is usually isolates, and here we are all isolated in one home. And I'm concerned about children. We think, you know, not every child is happy in their home. I have four. I have two that live here with me now and are not in school. And luckily, I hope they think they have a happy home. But there's children that are isolated themselves. Their parents may be on the front line in their home and an only child, and there's isolation, and that can cause depression. But to be in an abusive family and can't not being able to get away to be at your friend's house or such, I think this is very important information to get out there for someone that is feeling this.
Absolutely. And what we've seen is that absolutely we're going to see an increase in children who have been abused during this period, and that the schools may actually see more behavioral changes in September when the children return to school, because they've witnessed a lot more, they've experienced a lot more. And what we know for children who witness violence, that protective factors matter, and that if they have safe adults that they can go to or that they trust, that they feel safer and have better outcomes. But right now they are also isolated from their friends, from their outside family members, so that what they're experiencing is absolutely going to have an impact on their own behaviors. And once people are able to get out of their homes, it doesn't mean that the abuse is going to end, or that the long-term impact of becoming unemployed during this period will not continue to impact people who are living with abuse.
Wonderful information. Thank you, Sandra. I appreciate it. I'm sure there'll be many questions when we're done. Thank you. Now I'm going to introduce Jennie Babcock. You know, Jennie lost her niece 8 years ago, and when that happened, she vowed to take action to prevent other families from experiencing the same tragedy. Jennie is the chair of the Plymouth County Suicide Prevention Coalition. She has been working to inform others on how to prevent suicide and help those in need. And I know that Jennie trains all over the Commonwealth. Welcome, Jennie.
Hi, thank you. Thanks for inviting me.
Oh, I'm happy to have you here. A lot of what we've discussed today has to do with isolation. And I know isolation can lead to depression. And depression, as we can know, can lead to someone thinking of taking their lives. So, have you seen an increase during this time of this pandemic?
For the month of March, I will say there was an increase in Plymouth County of suicides when I look at compared to what the numbers were last year. So that has us alarmed going forward. I am also on the executive board for the state coalition, and during our executive meeting last week, the head of the Mass 211, her name is Eileen Davis, she actually told us during March, they took in over 500,000 calls.
Wow.
Average is between 12 and 13,000. So that's a huge jump. She said the average age of kids calling in, and it wasn't that they were suicidal, it was just that they were isolated and they need to talk to somebody. They may be confused, they may be going into depression, but the average age was between 11 and 12.
Wow.
And that's scary.
It is scary. So it is our younger people. I know before we had discussed this before this pandemic, we had spoken about our older population of isolation. And Sarah had touched on, just because we're social distancing, we really need to connect emotionally, especially with our older folks. Have you had any calls with our older people, or what would be your suggestions for reaching out?
I personally have not had any calls from older people. I've had calls from um, lost survivors that lost their um, groups to go to, lost their support groups. And they had contacted me, which actually kind of threw me into the idea of we need to do this through Zoom. Um, we have just started doing them in Plymouth County for support groups, so I'm still working on it. So watching, I guess, our website, our Facebook page of events coming up for for support groups would be one number that they could call. They could always call the suicide prevention line. They could call elder services in whatever town that they that they live in. Just they need socialization, just like Sarah said. We need to have those touches. We are starting a new campaign next week called Caring Cards, where we will be just sending good thoughts out to volunteers, to elderly, and to veterans. Veterans are another group, the older veterans that are isolated right now, and we have coffee socials for them every Friday in different towns. And those have stopped too. And that's to get them out of the house so that they have those personal connections. But we need to find another way. So we're starting this thing called Caring Cards that we're going to have volunteers fill them out, send them, and then we're going to be dropping them off at places. So I'm looking forward to getting that off the ground.
That sounds great. Can we go back to you said the average age was 11 to 12. What are some signs that parents or guardians can look out for to see if their child or their grandchild or their neighbor child is in need? Like, what are some of the signs that you can kind of tell us?
With youth, I think some of the signs are separation from friends, but that's already happening right now. Maybe more isolation in their bedroom, not coming out, not even calling their friends, talking to their friends, maybe on their Xbox or whatever game it is right now. Eating changes, drinking changes. We always say to people, watch your cabinets. Even if it's not a prescribed pill, they can do something with Tylenol. They can do something with Advil. So just watch your medications. That's something to keep an eye on. And just maybe some things that they say. In some of our trainings, we do talk about watching for those signs and signals. And, personal hygiene is a big clue. Even things that they may say, I just don't care anymore. I don't want to be around anymore. You won't have to think of me later on. Those are all signs that would make me say, are you thinking of suicide? And that's not something easily said. It did take me a long time to get to say it without issue. And we have to get the word out. We have to talk to people about trainings, about helping one another. And one of the big topics I had today at the national conference that I'm attending virtually is it's okay not to be okay. And I know we say that a lot, but if you're not okay, just talk to somebody and hopefully you will have somebody close.
Well, thank you, Jenny. I believe we have questions. Julie, did you have some questions that we could ask the panel?
Yes, actually, we have quite a few. Starting with Sandra, when you talked about the domestic violence and the people that you know are now probably more, they can succumb to violence probably more easily. They don't have the places to go that they had before. Do you make any outreach calls to families or to groups that you know, people that you know are in that situation, or is that not allowed for you to be doing that?
You're muted, Sandra. Sorry.
Yeah, we need Sandra in
There
the
we go.
car. Did you hear the question, Sandra?
Yes, I did. So we have gone remote with all of our services. So we are providing remote groups and remote individual. What we do is we still remain in contact with the police departments, and we are still reaching out to individuals that we are informed that there's incidents going on. We do reach out to our community partners. So yes, we do reach out to people who we may know have been involved in an abusive relationship. What we have to be extremely careful about is that if the person is living with the abuser, that a phone call from us could be extremely dangerous. So advocates are very careful as to who we reach out to, how we reach out to ensure that there's victim safety. That's the primary focus that we have, is to keep victims safe.
Okay. Yeah. Thank you. What an awful position to be in. And I had a question also for Sarah Cloud. With family members spending so much time together now, if someone's concerned about a family member excessively drinking, how should they get that person help now and not wait till this is over?
Yeah, I think that's a really great question, and it's challenging to navigate. If the person that you're concerned about is open to treatment, then that makes it a lot easier in terms of helping them reach out and connect, and get the help they need, depending on where they're at in their disease process. If they are not open to seeking help at that time, I think it's incredibly important for the family or the loved one to still reach out for support and help for themselves. Substance use disorders don't happen in a vacuum. It's not just one person going through it.
Mm-hmm.
The entire family goes through it together, and everybody and every member of the family needs support, and they need help through it. So if the individual is not interested in seeking services at this time and thinks that they don't have a problem, that's okay. That's where they're at right now. But the loved ones, the family members, should still reach out and seek services for themselves. A great way to start is a lot of excellent family groups in the area. There's Learn to Cope. There's the Addict in the Family, which is run out of Duxbury, which is really phenomenal to connect with. A lot of our local towns have FACT meetings that are now being done virtually. And probably the number one resource I can offer folks locally is a nonprofit called PCO Hope. PCO Hope has a lot of resources. We have a strong social media presence with a lot of information and resources. You can reach out to PCO Hope on Facebook or on Instagram, message us, say that you want help, you need connection. We can help you get connected with Narcan training, get you connected with family supports. We can even probably set up a type of intervention with the individual that you're worried about and try to connect them with what we call a recovery coach. So there's just a lot of resources. So PCO Hope, in addition to having social media presence and access, we also have an app. So if you go to your app store, you can download for free the PCO Hope app for both Androids and iPhones. And there's a lot of information resources, kind of a lifeline through that app as well.
That's wonderful. Thank you. And Kathleen, all this information you've put on your website, is that correct?
Correct.
Okay.
It's not on there now. It will be up shortly.
Okay, excellent. I did have a question for Jennie too, also on suicide prevention, and it was very disturbing to hear the age range of people that are thinking about this. As parents who, let's say parents that have to work, both parents have to work and they have to homeschool now. And what are aside from the things that you talked about, are there ways for parents to cut this off at the pass, to bring that subject up without it being inappropriate, if you know what I mean?
Yeah, it's not an easy subject. It's a difficult one to talk to your child about as well, but it needs to be done. If parents, if they have any questions, they can call the National Suicide Prevention Line, which is 1-800-273-8255. You can just ask questions. Doesn't mean you're in crisis that you have to call them, There's also the Cape Cod Samaritans that they can reach out to.
Mhm.
There's websites with the American Foundation for Suicide Prevention that actually has specific information just for parents and how to open up that conversation, how to have that conversation, as well as what to look for.
Okay, that's excellent information. Thank you. Also, it's to anyone too on this panel the question of, are there videos or are there websites or something where kids can go that kind of address all these really adult issues on a more age appropriate level so that it becomes just part of the learning experience of when you're isolated from your friends, when things are not the way they have been. Is there a way that we could steer kids or parents to have their kids go to some place special to watch something? Is there anything that any of you can recommend?
For teen dating violence and for domestic violence, there are good websites that Futures Without Violence has an extensive curriculum as well as resources and information for both parents, children, teens, that they have programs that are really geared towards tweens and teens, and then a lot of resources and information for survivors of abuse. I would say that that's the most extensive national website. And then for the state, there is Jane Doe, which is the coalition for it. They are the coalition for sexual assault and domestic violence, and they have a lot of resources and information that if anybody wants more resources or wants to discuss, they're always able to reach out to us. We have the 24-hour hotline, and we always have staff who are available to then direct age-appropriate books as well as movies that children can watch. There are actually some good resources for tweens and teens on YouTube, as well as documentaries and public service announcements and smaller movies that have been made to really highlight what they might be experiencing or what a friend might be experiencing or what a parent might be experiencing.
Excellent. Thank you. Sarah or Jenny, do you have anything to add?
Yeah, so Child and Family Services is a local agency, has recently put together a really great brochure and tip sheet on how to work with your children around coping skills. It's something we can certainly add to Kathy's website. It's also available within the PCO Hope app that I was referencing. The Center for Disease Control has also put together some really great information on coping, both for adults as well as for children. So that's been another great resource that we've been accessing during this time.
I'd like to pull up something before we have Jenny weigh in. I have something on the on our screen here. It's coping with disaster or traumatic event that the CDC, I believe, did put together. Anyone like to speak about this?
Yeah, so this is the library of resources that I referenced. The CDC has available, readily accessible through their website, and they also have similar one pages to help working with children, as well as healthcare providers and leaders during this pandemic. So there's a lot of really great information there on coping skills and what to expect and what's our normal reaction to what's happening this very unusual time.
Excellent. And Jenny, any videos or any TV shows or anything that you know of that could help kids of any age try to cope with that whole idea of suicide and how it is a permanent solution to a temporary problem?
Right. I love that you said that. Have you gone to my trainings? One of the main websites that we tell youth to go to is called the Trevor Project. It's TREVOR project.org. They have a slew of resources available and other websites within that. And it is mainly for teens, but also they address LGBTQ, which right now, even that, I guess, population right now is in crisis because they have no release. So that's a great one. Another one is through the American Foundation for Suicide Prevention. There is a program that we actually do within the school departments, and it's called More Than Sad. That actually has several videos within it that you can watch. So that's a good one to look at too.
Excellent, excellent resources. Thank you so much. Kathleen, that's all the questions I had so far.
Wonderful, thank you. I just, maybe Sarah can address this, but I feel, and I've said this several times, we're all grieving. We may not know that we're grieving, but we've all lost something. We've lost some our livelihoods, some our freedom. I mean, so many things. Do you feel that after this, it will be like going a grief process that we will all go through and at different levels?
Yeah, it's a really good point, and I don't think it will be after. I think it's happening right now. And I think we're all going through the stages of grieving currently, and there's so many different ways in which we do that, and so many different feelings of at times it's anger, other times it's denial. It just really kind of goes through the same kind of cycle as we would with any other loss, but there's so many different losses that I don't think it'll be some time before we realize the extent of the losses. And I think as we need to move through this, it's hard to know because there's no end point that's typically in sight. So I think as this kind of continues to unfold, and it will pass, we will get through this. There are definitely better days ahead. But I think it will just continue to unfold from here. And we will be in this state of both actively grieving and putting this all back together probably for some time. And I think that's okay. And as Jennie said, it's okay to not be okay. And it's just going to take time, but things will continue to move forward, and this will pass, and we'll get through it together.
Thank you. Julie, I believe you have one more question.
Yes, I do. Thank you. And it's to really anyone on the panel who'd like to answer it. The viewer writes, is there an effective role that faith leaders can play in this crisis in breaking through the isolation? As mandatory reporters and those who have more private dialogue with those in their communities by nature, what ways can faith leaders or mandatory reporters find a way to help people get their mental health resources that they need at this time? Who'd like to take it first? Sarah.
I think.
Okay.
All right.
Sandra.
I've really been pleasantly surprised to see and hear from the spiritual leaders in our community how much, again, they've gone from in-person, sermons and sessions to virtual as well, and to see the huge spike in participation and the audience that are more than ever now participating in these virtual sessions. And I think that's huge. So I think a lot of folks are reaching out for that connection and for that guidance, and have a lot more time to kind of focus on that. So I think it's been very important. And I think our spiritual leaders in particular know that they have an opportunity here to make a difference and to lead, and are really stepping up to do so. I know Pastor Neil Eaton is on the board with me at PCO Hope, and I know he's always been a very active community member, as is a lot of his colleagues in our community. We're very fortunate in that regard, and I know that he has specifically been addressing these topics in his sermons and how he's reaching his audience in that regards as well. So I think there's a tremendous opportunity, and I think our leaders are taking advantage of that to make the most of it.
Yeah, that's really good, and we've heard that on a number of forums. We've had a number of clergy come on from all different faiths, and they said exactly what you just said. And the outreach is incredible, and the participation has really astounded some of them. How much the remote participation means to people. Sandra or Jennie, do you have anything to add to that viewer's question? Sandra, go to you first in the car.
I think that for faith leaders, if they do hear that someone is being abused, to contact our agency to give resources and referrals, and to let the survivor know, the person who's being abused know that they're not to blame, and that there is a way out, and that there is help. I think oftentimes people who are being abused, it's very scary to speak out and to let someone know, especially because the nature of abuse is that very often the abuser is very well liked in the community, and maybe someone of stature within the faith community, within their own church or within their own faith, and that it may also be someone who is very, very well known or liked within the community, and people may not necessarily always believe the victim. And what we try to really impress upon all people is that to let a victim know that they're not to blame, and that very often it is the abuser who really does appeal to those within the community, because oftentimes abuse happens behind closed doors, and that the abuser is not someone where you meet them on the street and you think, wow, this person isn't nice. Oftentimes it's the exact opposite, that the person's very charismatic. And so what we encourage faith leaders as well as other community leaders is that if someone comes to you and says that they're being abused, and you know their partner, and it seems astounding that that's very often the case with abuse, that it's the perpetrator who often is the person that people think is a very nice individual, because outside of their home, that is the presentation they are given. And to give our number, and they can feel free to give us a call, because we're more than happy to speak to faith leaders, and we're very happy to also take that referral.
Right, thank you. Jennie, with suicide prevention, how can faith leaders help you? And I know there's always that thing about confidentiality, and how do you break through that?
Well, fortunately, I actually have a faith leader on my steering board with the coalition. So he's a great help to us. We often get calls from churches or even from funeral directors to let us know that something has happened. It is a privacy issue. I actually work with the DA and get some other information. And if we can find out the people's name, we will call. We will try and help. I've done calls myself. I've done house calls just to go and talk with people, to let them know that we're here to listen. That's my main goal. I want to help anyone else that has gone through what we have gone through in my family. And just know that there's help. Deacon Jim, who is my faith leader in my coalition, he works very closely with the Archdiocese of Boston. So we have a lot of connections.
That's excellent. Thank you. Kathleen, every Friday for the next few Fridays, you're going to be having this type of forum with different guests, and all really to do with mental health. Is that correct?
That is correct. I think we need to continue this discussion. A lot of people have never experienced their feelings that they're having now, or haven't had their children home, and they're looking for resources. And I want to make sure that everyone knows that there are resources out there, and they just need to reach out. We need to end the stigma on mental health and mental illness, and we really need to just take it head on and give as many resources as we can to individuals that need it, and hope that they take advantage of it. And again, isolation, as Sarah had said, and I'm hearing all along, because we have to social distance does not mean emotional distance. This is a great time to get in touch with some of your old friends from high school, or reach out to an aunt or uncle, an elderly aunt or uncle that you haven't spoken to in a long time. It's not just only a gift for them, it's a gift for yourself, because you'll feel better by reaching out. And I want to emphasize, there's a lot of older people that live alone, and any way you can reach out. I love the idea, Jennie, of the cards. And in our service members, I have a son that's on lockdown in Poland with, when you speak to him, I know that he's depressed and I'm so far away and there's nothing that I can do about that except let him know that we're here for him and send cards and FaceTime and that thing. We're in an age where we do have that ability to FaceTime, or what we're doing now, which is Zooming. I mean, we should have all put our money into Zoom, right? But this is a great opportunity for all of us to reach out to others.
Yeah.
So thank you, Julie, for allowing me to have this here on a different basis on Fridays. We will touch on different things each Friday. We'll try to have a few panelists that will just devote themselves to one topic. And I encourage people to write in or even email my office questions. I will again have on my website all these resources to reach out to. There's also the CDC website that lists everything as well.
Excellent, thank you. And today you've really done such a justice to this by bringing to the forefront in one forum the obviously the physical abuse that's happening in some homes, the opioid addiction, the alcohol addiction, all those types of things that are they're becoming more prevalent, and of course suicide. Parents, or all of us really at this point, are almost overwhelmed by all the different subject matters we have to now completely change our thinking towards. Our physical health, what we're eating, where we're going, how we're dressing, how we react to each other. And like you said, Kathy, it's so important how you reach out to people all the time. It's good to keep this information in the forefronts of our heads, because everybody, you're right, all the different age groups, the veterans, the LGBTQ community, kids, parents, working parents, parents who have lost their jobs, who for the first time ever have to go to a food bank or have to apply for unemployment. And what does that do to their psyche? It's almost overwhelming unless you take a deep breath and almost take one thing at a time. And I think your guests today were so critical, because they're right on their subject matter. And it is so obvious, Kathy, that there's so much out there for people, resources for people to use.
And they just need to know that they're there. Those resources are there. So one of my goals is to bring those resources to the public and to my constituents so they can access them and hopefully gain some help or assistance.
Right. And what we usually do in forums is we go through the panel one last time and say, is there a final takeaway that you would like your viewing audience to take from this particular forum we had today? So could we start with Sarah, your final takeaway?
You know, I think we really hit a lot upon just continuing to stay social connected. It is so important for our health, our mental well-being. And I think a lot of parents are in different situations, but all kind of struggling with the same things and how can support our children. And I think we've given the opportunity to kind of slow down and to maybe resume having family dinners and staying connected with our children of all ages, and really trying to take advantage of that to reopen the lines of communication is a really important piece. We can't fix what is being lost right now, particularly for our seniors that are about to graduate. I know that there's a number of us, a whole slew of us that have children in that situation, and we can't make that better for them or fix this, but we can be present for them. We can be available and reopen those lines of communication that may have gotten lost in the shuffle before, because it happens. Everybody's going in a different direction. So take advantage of this time to reconnect and open lines of communication and just be there for each other. So that would be my final thought.
Thank you so much. Sandra, final thoughts to the people watching today?
Yeah, for survivors who may be watching, to know that our services are available, that they are free, they are confidential, that our food pantry is open, and that we are there to assist in any way that we can, and to know that you're really not alone and that we are here. And to take away from that there are a lot of people within the community who are here to help and are here to listen.
Thank you. And Jennie, final words for takeaways for people to remember?
Sure. Again, it's okay not to be okay. My favorite word is hope. There is always hope. So if anyone is struggling, please call the 1-800 number for National Suicide Prevention Hotline. Again, 1-800-273-8255. Veterans can press 1 and have an immediate prompt. There is always hope. And if somebody even just wants to talk to me, they can contact me. It's more, I do peer-to-peer counseling. I am not a counselor. And by any means, I am just a lost survivor. I am a parent of someone who suffers with mental illness. And I just want to help any way I can.
Thank you. Kathy, final words to your viewing audience today?
Yes, first I want to thank my panel so much, Sarah, Jennie, and Sandra. It was a pleasure, and I really appreciate you taking the time to reach out. Like everyone has said, it's okay not to be okay. We are all grieving in different ways. Everybody's going through something. Do not be afraid to reach out. You can always reach out to my office as well. It will be strictly confidential, I promise you, but I can connect you to the resource that you need. And thank you so much for allowing us to have this forum today.
Oh, thank you. And you're all right. Nothing is forever. And find the good. Try to find something that gives you hope. I mean, all of you have said something I hope that rings true to someone out there who's listening to it. I know that I've told my staff here at PAC-TV that people react differently to things when situations change, and we don't know what's going on inside someone's home or in their environment or in their family, and to be a little bit more patient with how people are reacting to things, because struggles aren't always visible. And I think, Kathy, what you've done today is really great, is open up that conversation, and I'm looking forward to this continuing next week because it's so important. So thank you, Kathy LaNatra, for organizing this. It was a wonderful, wonderful thing to do. And for all of you out there, if you want to watch this again, please go to pactv.org/regional, and Kathy will also have it on her website. This is Julie Thompson from PAC-TV. We're thanking all our guests. Thank you, be safe, and we'll see you next week.